If we were going to measure the amount of good health that was produced in 1923, 1922, the lion's share was done by the visiting nurses, and quietly, one house at a time, one family, one patient at a time. In 1922, the hospital employed one administrator who was at the beginning not a nurse, and then in the middle years was a nurse, and then nurses and a few orderlies to carry people up that central stairway to the second floor. No elevator in that building. So the doctors were only in the building briefly if they were delivering a baby or doing an operation, or they were leaving instructions about what medications or treatments to give a patient. The health care was largely delivered by the nurses. The hospital was run by the nurses. The nurses have always been a very central part of the mission of South Shore Hospital, a very central part of how stuff actually gets done. Most of the stuff that happens at the bedside, the drugs are given, the vital signs are taken, the therapies are delivered, the patients are gotten out of bed, they're cleaned, they're taken care of by nurses. Most of the work is done by nurses, and most of the really hard work is done by nurses, caring for people while they're dying, caring for people while they're critically ill. You know, these COVID patients who were on ventilators and were very, very ill had a nurse in their room all the time. The doctors came and went. So true in 1922, true in 2022, that if you're going to go to the bedside and see what's actually happening to people who are sick, injured, whatever in the hospital, what they're seeing is a nurse.